Hi, my name is Julia Steinberg. I'm a Senior Research Fellow at the Daffodil Centre in Sydney, Australia, and lead author on a study of genetic risk prediction for melanoma that has recently been published by the British Journal of Dermatology. Melanoma is a relatively lethal form of skin cancer with high and growing global burden. While most melanomas globally are due to excess UV exposure, previous studies have also shown that genetic predisposition is an important risk factor for melanoma. So we wanted to test whether and how well genetic information could currently help improve melanoma risk prediction. Sufficiently accurate risk prediction for melanoma could potentially pave the path for risk-stratified melanoma prevention or early detection, providing the right support to the right people at the right time, which might help deliver more effective and efficient testing and diagnosis for melanoma to improve melanoma early detection patient outcomes in the future by reducing screening-associated harms, healthcare resource use, and costs. Melanoma risk prediction is therefore a very important research topic. In our study, we considered 3 genetic risk scores for melanoma based on 45 to 68 known genetic risk variants. We evaluated these 3 so-called polygenic risk scores or genomic risk scores in 2 large Australian and UK cohorts. We found that incorporating genetic information significantly improved melanoma risk prediction compared to estimates based on age and sex alone. Our results suggest that genetic risk prediction for melanoma might help tailor melanoma prevention or early detection strategies to different risk levels. For example, we asked when people with different genetic risk for melanoma might reach the average risk level of the 50-year-old in the UK or in Australia. Our estimates suggest that the 20% of people with highest genetic risk for melanoma would reach this level 10 to 20 years earlier, so around 30 to 40 years on average. By contrast, the 20% of people with the lowest genetic risk for melanoma might not reach the same absolute risk for melanoma until quite a bit later, around age 60 to 80 years on average. However, we also found that predicting absolute risk levels for melanoma remains challenging. That is, predicting how many people in a high risk or low risk group might develop melanoma over the next 10 years, say. This is important as most cancer prevention and early detection programs are based on absolute risk thresholds. Our study also only included individuals with European ancestry, which is a major limitation. In summary, our work suggests that melanoma genetic risk prediction has promise, but ensuring risk predictions are accurate and can be applied to diverse populations remain key research priorities before these risk predictions are ready for use by dermatologists and their patients. Thank you very much for your attention.